Hello, everyone. It's nice to see you today. My name is Dr. Han, and I'm joined with Dr. Fernandez.
I am Dr. Fernandez, everyone. Nice to meet you guys. We are from Ryan Health, and our clinic is the Wadsworth Clinic, which is on 181st Street and Wadsworth Avenue. And we're happy to see you guys today.
So both of us are family medicine physicians, which means that we see everybody from newborns to our elderly patients. And so we are excited to be here together to talk about RSV. And I'm sure you have heard of RSV in the news, and maybe family members or classmates or friends that you know who have been dealing with RSV or feeling sick. And as we know, RSV has been very prominent this winter and has been filling our beds in the ED as well as in the inpatient wards for pediatrics. So we are here to just talk about what RSV is and what the symptoms are at home, who can be affected, and field some questions at the end. So what is RSV? So RSV, as the name suggests, is a respiratory virus, and it can actually affect patients of all ages. And so all of us, from the infants to elderly, we can all be affected by this virus. And we are all very familiar with viruses by this point and know that they do affect us more so in certain times of the year. And similarly to the flu and similarly to COVID, the RSV surge is usually in the late fall and all the way to early spring in the US. And there are sharp increases in the US hospitalizations that we have already seen since mid-November of this year. And just to know that RSV itself is also a global virus in the sense that it's the second leading cause of death for infants. And so who is at risk for RSV? Children with diseases of the lung, heart, or immune system, so things that maybe they were born with or different diseases that they are fighting. So those children are at more risk. Babies who are born premature or those babies who are very young, they are more at risk. And then also our adults who are over 65 years old. And this is really not highlighted too much. When we talk about RSV, I think we seem to focus a lot on the pediatric and young children, but our adults who are over 65 years old are also at risk for RSV. However, just like we have heard in the news and those around us, severe RSV primarily is in infants and those infants who are less than 6 months old. And so what are the symptoms? So RSV is very similar to our normal colds and that we get in the winter. The first 2 days are like runny nose, congestion, cough, sore throat, fever. So it's hard to differentiate really if it's RSV versus other things. And then why are we so concerned about RSV if it's really just a typical cold? Well, that's because after 3 days or so, there are delayed symptoms where all of that upper respiratory, so those symptoms that are up top, runny nose, cough, fever, sore throat, all of those kind of move down and tend to affect the airways and the large airways in our throat as well as in our lungs. And this is why those children who already have lung disease or those children who are already have heart disease or the very, very young who their systems are still maturing and strengthening, they are more at risk. And so some of the symptoms that we have as it tends to affect our lungs and our airways is that pneumonia sets in our lungs, or they have wheezing where they have difficulty breathing and exchanging air, and worsening of asthma if children have asthma or if adults have asthma. And so those are the symptoms that tend to cause more severe symptoms of RSV.
Okay, so I'll take over now. Thank you, Dr. Han. But please chime in if you remember anything in between. So, like Dr. Han was saying, so one thing that I just want to go back and remind everyone, most children have already been exposed to RSV by the time they're 2 years old. So it is just like a common cold, and it's only 2 to 3% of children that might get severe symptoms and might require hospitalization. So let's first talk about how we treat it at home so we know what to look out for and what we can do at home to treat it, right? Because most of us, a lot of us know we don't want to be running to the emergency room if it's not necessary. Unfortunately, sometimes you go to the emergency room, there's long wait times. So the emergency room is really for emergencies, right? We want to be able to treat things at home when we can, or come to clinic and get reassurance and have your child examined, and see if we really need to go to the emergency room, or we can treat this at home. So most important things with RSV is we want to make sure that children can tolerate oral fluids. So that means that they can drink, whether it's milk or juice or water or anything liquid, a little bit of soup. If at their age that they're eating soup or anything, RSV, just like any common cold, when you have nasal congestion, it makes it difficult to eat. And it is normal to have decreased appetite. Think of any of us, when we have a cold, we're kind of a little tired. We don't really want to eat. We just want to rest. All those things are normal, but we can't go without eating. So we want to look out for, to make sure that the children are hydrating well, is that they have enough wet diapers, or that they're going to the bathroom and urinating, and that their lips are not very dry, that their nose is not too dry, that their mouth is not too dry. You want to look in the mouth. So these are signs that they're hydrating well. Also, are they producing tears if they cry? If they're upset and a little irritated, like if they're crying, no tears, dry mouth, not producing wet diapers, then that's an indication that maybe we can't treat this at home. We need to go to the emergency room. Also, Tylenol as indicated, as needed for fever. Remember, fever is 100.4 or more. And this is, of course, for children that are, more than a month old, or, if it's less than a month, less than 30-day old, it's a newborn. If the temperature is less than like 97.6 degrees, 97.8, or any temperature at 30 days of less of life in a newborn, that requires evaluation. We're talking about for a little bit older children, right? After a month, 2 months, definitely after the 30 days. So for the kids that are home, if you can give them Tylenol, according, of course, to their weight, you look in the bottle, and the ibuprofen as well, and ibuprofen for 6 months or older. We want to help them with the congestion, so using a lot of nasal saline, using the little bulb aspirator, the bulb suction. They have a lot of new ones out in the market. So you guys can Google and see all the different ones that are out there. But the old ones sometimes don't work too great. But the important thing is actually using the nasal saline and suctioning, maybe right before you do feeding. And then also in between, you feed a little bit, use a little saline suction, feed a little more. It's okay to feed frequently, because they can't feed too long, because you get congested right away. So you can feed a little bit, and every let's say half an hour, every hour, try giving them a little something to eat or drink. Having the cool mist humidifier also really helps. We can move on to the next one. Do you have the thing to move? Yeah. Okay. So when do we need to go to the emergency room? If you are doing everything at home, you're using the nasal saline, you're using the suction, and your baby is not eating at all, or very, very minimal. Let's say you're not really seeing any wet diapers, they're not really urinating if they're old enough and the potty trained. If you see that they're really struggling to breathe, and they're really tired, and just very extremely exhausted, you see their nostrils are flaring, so kind of like every time they breathe, it's like opening and closing. If you see they're making noises when they're breathing, but it's like really, like you see that they're working hard to breathe. If you see that their ribs flare in and out too, you'll see their little chest, and you'll see the ribs come in and out with every breath. It's like everything's working a lot. Then that's a time to go to the emergency room. Even if you see that you're trying to feed them, they're not eating at all. And like we said, with the dry lips, the dry mouth, the dry nose, extremely drowsy. So it's normal to be tired, a little tired, but if they're very drowsy, then that's time to go to the emergency room. And then if they have a fever and it's not coming down with Tylenol and ibuprofen, then we need to go to the emergency room. Now, if they're eating well, they're producing diapers, and they still have a fever, but you're giving them Tylenol or ibuprofen, and the fever goes away, it's normal that it might come back. When you have a viral infection, sometimes you have a fever for a couple days. But as long as they're eating, they're okay at home, they're producing their wet diapers, you're able to help them a little bit the congestion, then that's okay. So just the fever alone doesn't, you don't have to rush to the ER. And of course, you can always call us. We can do a video visit or come into the clinic, and we'll help you decide if we need to go to the ER. We can go to the next one. How do we prevent RSV? So, most important thing, even though with little kids, we all know is hard, and even with some adults, to remind them to wash their hands. But washing your hands, cleaning surfaces frequently, avoid being around sick people. So, if you have any signs or symptoms of a cold, or your family member does, or your little cousin, even if you have a little get together planned, even if it's a little play date, it's best to avoid it for now, to avoid being around anybody with symptoms of a cold. And of course, teaching the children how to cover their mouth when they have a cold, wear a mask if possible, don't share glasses, avoid tobacco and secondhand smoke. Now, we know a lot of these things are very difficult with children, especially if they're in school or daycare. You know, kids run around and they touch their face, they touch other people's face, they grab other children's cups. It is difficult, but it's not impossible. You know, we just got to keep trying, wiping everything down, washing your hands, teaching children how to wash their hands uh, repeatedly. And then, of course, getting vaccinated is very, very important. When you are vaccinated against COVID-19 or the flu, it helps to reduce the days that you might have symptoms if you have a cold, if you're exposed to RSV, and also how quickly you might be able to infect others. It doesn't mean you can never get it. You can get a cold. I right now have a little stuffy nose. But thank God it's just a stuffy nose, and I'm not having fevers, body aches, and same thing with children. They might have a stuffy nose, they might not feel well, but usually they can recover a little quickly from their colds. And then, oh, very important, with temperatures, when you say a child has a fever, you want to be able to measure the temperature. So everyone at home should have a thermometer, one or two, and they sell the thermometers in the pharmacy. They also have the little probe cover, so you can accurately check the temperature. For children, newborns, and younger children, we recommend the rectal temperature. And whenever you come to clinic, we could teach you how to measure the temperature that way. Okay. So
Yeah, so I
here's,
guess
yeah, go ahead.
something to add on is that if you have older children at home and then you have an infant at home, really the infant at home is the one that we need to protect, right? So we have to make sure that when the children come home from outside, that if you have elderly or if you have infants, that then the siblings are not passing it on to whoever is at home, right? So then washing our hands is not when we're out also around other people, but to protect those loved ones at home. So we could wash our hands and the frequently touched surfaces like car doors and door handles and things like that. I'm sure by now we are all very good at wiping down things after 2 years or 3 years of the pandemic, but all those things are the same. Viruses are transmitted the same. And I know now the masks have kind of gone by the wayside when we are around people or when we're in gatherings, but sometimes, like Dr. Fernandez was saying, if we can avoid some surroundings, like if you're commuting or if they're in school, then maybe during this time when there is a surge of RSV or when we see, and I just this morning I had a 5-year-old result come back with flu and COVID together. And so we are definitely seeing the surges here in our clinic, and there are children coming with active fevers to our clinic to say, for the parents to say like, hey, what is going on? Is it flu? Is it COVID? Is it RSV? And we are helping and to decipher and to see if they can be cared for at home or not, just like Dr. Fernandez was saying. And so we can try to avoid being contaminated or being contagious by wearing a mask, by covering our coughs, by avoiding, being in crowded places, all the things that we have already been doing the last couple of years.
Yes. So we have a couple questions, Dr. Han. Do you want to? So our question
Sure.
number one from one of our listeners is there anything I should do if my child is exposed to another child in daycare?
Well, that's a very good question because I'm sure, just as I am, and I have a child in daycare too, you're getting those letters at home from daycare saying, "Oh, we have had a case of RSV at school," or "We have had a case of COVID exposure." And so I'm sure the parents are getting these types of notices. And the best thing we can do is, like I said, practice our hygiene practices, and then monitor your child for symptoms. Obviously, daycare has their own policy in terms of when when a child with symptoms can join and what types of symptoms are allowed for them to come or not. Usually, if any fever, they need to stay home. And then just monitor for those symptoms. And we can do all those things to boost our immune system by eating healthy, nutritious foods, getting good night's sleep, just so that our immune system is as robust as possible. And so that's what we can do, and then monitor our children for symptoms, and then And then, like we said, Dr. Fernandez said we can try to prevent all these other things, the flu, what we have vaccines for. We want to protect our children. So flu vaccine and COVID vaccine is still very recommended for our young children as well.
Okay.
Question 2, how often do children with RSV have to go to the emergency room?
So like we said, yeah. So like we were saying before, so you have to go to the emergency room if you have any severe, moderate to severe symptoms. So moderate to serious symptoms are a fever that does not improve with Tylenol or ibuprofen or resolve, and it is normal for it to come back. So the fever can come back as long as you can keep treating it and bringing it down to a normal temperature. Then the Tylenol and the ibuprofen is working. So when you have a viral infection, you can have a fever for a couple days. 2, if they're not eating or drinking anything. So if your child is not drinking anything, not producing any wet diapers, not urinating, very, very exhausted and like tired and just more than what it'd be before normal cold. So it's normal to be tired a little bit and just want to rest. But if they're very, very drowsy, then you have to go to the emergency room. Trouble breathing, so the nose flaring when they're breathing, or the ribs in and out when they're breathing, or they're grunting, making noises when they're breathing, just like a lot of difficulty. Any, God forbid, any lips turning any color, emergency room. And it's not that often. It's 2 to 3% of children that usually have to go to the emergency room. Now we have a surge because a lot of our kids haven't been exposed to RSV because they haven't been in daycare, and because of the pandemic, everyone's using masks. So maybe our immunity, we haven't been able to fight it off as usual, because most children have already been exposed to RSV by the time they're 2. So that's why we have this big surge now. And we do have a lot of children and adults that are not vaccinated. So that's also becomes an issue because any little cold can become complicated and can become pneumonia. So those are the reasons to go to the emergency room. And of course, even if you have I wouldn't say if you have none of those symptoms but you're concerned, then come to the clinic. Come to Ryan Health Center. We'll check the vitals. We'll check your child. We'll discuss everything with you. And if we think they have to go to the emergency room, we'll help you get there as soon as possible. But if we feel the child is okay, we'll review the signs and symptoms with you and let you know when you would have to go. Question number 3, if I'm not sure how serious it is, how can I have a Ryan Health evaluate my child? And what does the process look like in person versus a video appointment?
So I think with our younger children, we would rather see them in person. I think Dr. Fernandez would agree with me, just because the evaluation just can be so much more complete and comprehensive. And we can listen to the child, we can listen to the lungs to know really, is it still just upper airway symptoms that are just mainly congestion? If we help the congestion, will they drink, eat better? Or has it moved down to those lower symptoms, past day 3, 4, 5, where really they are struggling to breathe, or it has set in their lungs, or they are at risk for, increased congestion in their chest. We need to evaluate that, and that's best done in person. It's obviously hard to do.
And
so
also,
I would say in person is better, especially for the younger of our pediatric populations.
Yes, for the older ones, I mean, we can ask them questions. If you can't make it into clinic, through a video chat, we can ask them questions. We can see how they're breathing and all that stuff. If you just can't make it, period, and you still want to talk to a provider, you can call the number on the screen, which is our main number for all our Ryan Health Center, 212-749-1820. If you can't get through, the earlier the better that you come to the center, the better. The earlier the better. I just said the same thing again. But we do have same day appointments available. And of course, if you come in, let's say usually our schedule in Wadsworth is 9 to 5. We're working on evening hours some days. But usually 9 to 5, if you're there by 9, it's easier to squeeze you in and see the child and be able to examine them for a sick visit. We don't do same day regular visits or physicals, but when it's a sick visit, that's something that can be taken care of quickly and the child can be evaluated. So you could call our number, get a same day appointment. If you're calling, you can't get through for some reason, usually I've had good, all my patients have told me they have been able to get through. It's very rare that they cannot. But if you cannot and your child is sick, just come in at 9 o'clock, because that's the start of the day. We're all there and we can see your child or squeeze them in as quickly as possible. And on video, like we said, that's how we can do an evaluation. Question 4, is there a lot of RSV in New York City right now?
Um, yeah, I think we've said it many times. There is a lot of RSV in New York City. Sometimes we don't capture all of the RSV illnesses because we're not swabbing everybody with a cold. But definitely our pediatric units are filling up in our capacity. I had a friend actually who went to the ER for their child who ultimately was diagnosed with RSV, but they said the pediatric ER is overflowing into the adult ER, which is very unusual. It's usually the adults that are crowding the children out, but that's how many children are going to the ER right now. And so maybe not all of them stay, but the parents are worried enough to take them to the ER. So I would say there is a lot of RSV going on. There is, like we had in the earlier slide, the triple pandemic of flu and COVID still around. And just like Dr. Fernandez was saying, maybe we haven't been as robust in terms of our immune system in the last couple of years because we were shielded from so many things, these types of viruses and that are out there. And so it is very real, and there is a lot in the center. And to be honest with you, the next question is asking, do we really need to know if it's RSV? That's a very, very, very good question because actually, to be very frank, we don't have a test for RSV out in our outpatient. So if you come in, I can swab you, or if indicated, we can swab for flu and COVID, but we don't have an outpatient test for RSV. That is actually just reserved for the emergency room or inpatient wards if and when it matters. And you're right, it doesn't matter if it's cold or RSV. It matters the child in front of us. It matters the patient in front of us, whether they are dealing with their symptoms well. And it could be a slew of other viruses that cause the common cold, and they themselves can cause pneumonia or complications too. So we have to treat the patient that is in front of us or the child that you have at home in terms of the home treatments that we talked about how we support their symptoms, or if we have to evaluate that they are struggling with the basic things to eating and hydrating and breathing, and they need further care. So the treatment is at home the same, and then in the hospital it will depend on the child and how they are doing.
Yeah, and it's actually the American Academy of Pediatrics and the American Academy of Family Physicians both do not recommend routine testing or any more, any more like any routine testing for RSV because it is a common cold. So it doesn't change the management. It's all the same, just treating the symptoms, unless we think there might be a more severe infection. So if on exam or the fever's not resolving with the Tylenol and ibuprofen, or they're having a lot of difficulty breathing, and we think there might be something else like a pneumonia, then at that time you might need antibiotics. Other than that, you don't need antibiotics or steroids or nebulizing treatments or pumps or anything like that. It's just symptomatic treatment. Okay, next question is how long does RSV last? So just like any cold, it can be a week and sometimes a little more than a week. First, you have a couple symptoms for like 3-4 days. Then sometimes the symptoms hopefully improve. Sometimes they can get a little worse, but you can have a fever sometimes for a week or a couple more days. What we're looking for
And
is like,
sometimes
yeah,
the nasal congestion is lingering, or that little cough that won't go away. So it's hard to say like it will be X number of days because some of those symptoms just resolve over time. But I think the worst of it is we'll see in the first week,
yeah.
definitely with the fevers.
And when we have that cough after a cold, when kids have it, adults we have it too. After your cold has gone away, sometimes you can still have some nasal congestion, but we call that cough like a post nasal drip. So your sinuses are all draining, cleaning itself out. You've had all that mucus and phlegm from the cold. That's what sometimes can trigger your cough. That can sometimes last a little longer. So in older kids and adults, we can treat that with an antihistamine like Claritin, Zyrtec, which is Cetirizine, things like that, and that might help. But that's after your cold has resolved. In younger kids, we'll still have to continue with the nasal saline and the suctioning and just supportive treatment, the cool mist humidifier and things like that. I have a 3-year-old who was born at 26 weeks premature. He received the 4 doses of Synagis vaccine the ending of 2019 into 2020. I read that the vaccine doesn't work for RSV now. Is that true? So, Synagis,
Um,
go
mhm.
ahead.
Yeah, so this vaccine is actually very, very particular to our premature infants. and those infants who may have been born and needed, ICU treatment or intubation or supplemental oxygen or some support in the early when they were born. So I'm not sure about how RSV strains have changed now versus then, although I can tell you that this vaccine is still recommended for those who fit that the criteria. And so if there was a 26-week-old who was born now, it is still recommended because we are at RSV season. So that I can tell you. I'm not sure really the data behind are the RSV strains now versus the vaccine. I'm not sure if the vaccine also evolves with the strains just because we don't administer them in our centers. So I'm not sure, but I can tell you that it is still indicated for this type of premature infants.
Okay, and then just to clarify, so the Synagis is not a vaccine; it's actually an antibody. So you're receiving prophylaxis within the antibody treatment. So that's why that treatment for children that are born before 29 weeks, so premature, for children that have chronic lung disease, for children that have significant heart disease, then they would get a monthly injection. I think up to five monthly doses. So in up to 5 monthly doses. So your infectious disease physician would decide how to your child would receive that. But it's special for those cases. So born before 29 weeks with significant heart disease or with significant chronic lung disease. I think that might be all the questions we have for now. So the most important thing, the most important thing of this presentation was just to connect with you guys, reassure you that RSV is a common cold, but we want to look out for any symptoms that might indicate a severe infection, moderate to severe. We also want to let you know that we're here at Ryan Health Center to help you guys and see your children. We have same-day appointments available. You can see our number screen or just Google us and find us. And also just to make sure that you know that a lot of things we can manage at home. Kids get colds a lot in daycare, in school. We have to teach them a lot about hygiene, and adults too. We have to keep up with that as well. We get colds too. I have a little stuffy nose right now too. So
thank you so much for joining us. We're excited to see you in the clinic at the health center. And then if there's any follow-up questions, you can reach us or schedule an appointment, and we'll be happy to see you and your families.
Okay.
Thank you.
Have a great evening, everyone.